Welcome to your YouTube channel Vitamin C. We always talk about cash, career, and clarity. Today we are going to talk about care because care is also an important part of your life. Also, in today's time, care has become most important part of your life. So today we have with us Dr. Kunjan Joshi. He is a critical care medicine expert. He has been serving patients for more than 10 years now, and he has been serving COVID patients since the inception of in our country. He has been serving COVID patients as a home care as well, and he has been serving COVID patients in ICU as well. Welcome, Dr. Kunjan Joshi. Thank you for joining with us.
Thank you.
The first question arrives when anybody is talking about COVID or Corona. Are both the same thing, coronavirus and COVID? Those two are the same thing?
They are complementary to each other.
Okay.
So basically, coronavirus, scientifically named as nCoV-19, novel coronavirus 2019.
Okay.
So it has been detected first time in 2019.
Mhm.
We can say it's a cousin of swine flu.
Okay.
And COVID-19 is a term coined to describe the disease caused by this nCoV-19 virus.
Okay.
So, COVID-19 is a mixture of multiple symptoms. So, in layman term, it is like Plasmodium causes malaria, nCoV causes COVID-19.
Okay. So they all belong from the same family as well.
It's a swine flu kind of virus.
Okay.
So basically, it is affecting our lungs. A virus attacking our lungs.
Okay.
So
now, I mean, the complete scenario has been changed since COVID-19 was, we have been detecting patients in COVID-19. Do you think is it really dangerous for the world? The world is carrying a lot. We have stopped our business, we have stopped our life. Do you really think that the virus is so dangerous that we should stop everything and we should only, take care of ourselves from that?
Previously, there was a matter of fear of unknown. We stopped to know the disease, to know the virus. Still, we have very limited experience of, say, 9-10 months or 1 year.
Right.
But now, I would say, no, you don't need to worry for this virus.
Okay.
This is not a powerful virus. I would say it is a bechara virus.
Okay.
That cannot cause direct injury to you.
Okay.
So what is in fact causing harm to us? It is the immune response against virus from our body.
Okay.
So that is causing harm to us.
Okay.
So we should understand the nature of disease, pathophysiology, and that is saying us that no, it is not as dangerous as it has been projected previously. Still, I don't say don't be careless.
Okay.
One has to be careful, one has to be awake, but don't worry.
Okay.
Don't get panic.
Okay. So thank you for taking us through that what is COVID-19 and what is Corona and how dangerous it is for the world. Now, what are the symptoms one should expect if they really feeling that they have COVID or not? What are the signs they get? Is there any solid thing which can define that yes the patient is COVID or not COVID?
Yes. See, the most common symptom is fever. Second, we can look for dry cough. Third, we should look for loss of taste. Fourth, loss of smell.
Okay.
Fifth, diarrhea. So, one of these, or more than one of these, or all these five, these cover more than 80% of patient.
Okay.
So, we should look for these five symptoms.
Okay. So, is it a combination of all five or either one of them?
Any one of them.
Okay.
Any one of them can be there. Surprisingly, I would say nearly more than 3/4 of the patient do not have any symptoms.
Oh.
They are silent carriers, and that is why this disease is spreading like anything.
Okay. It is even more dangerous.
It is even more dangerous because more than 3/4 patients are asymptomatic. You won't feel that you have COVID disease. Sometimes just a single spike of fever or just a small loss of smell, loss of taste. These kind of mild symptoms can be there.
Okay. So, I mean, we've talked about that, what are the signs of Corona. We know that once we've been detected with COVID positive, whom to reach out to. But what are the preventive measurement we should take so that we can, save ourselves from getting positive?
Basically, prevention is the only cure right now. So it is a very important question. What is said new normal in current era? SMS, sanitization, mask, and social distancing.
Oh,
This is the most important thing one should follow, and that is the only thing which one can follow. So, this SMS, staying 3 feet away from anybody, wearing mask while talking to anyone, wearing mask while going in crowded area or closed area like theater, mall, restaurant, etc. And uh, one should boost their immunity. Now, how to boost the immunity? The most important thing which we were not doing in pre-COVID era is lifestyle. Getting up at the right time, sleeping at the right time, 10 hours sleep, rest, stress-free life, and a good social interaction with social distancing.
okay.
So these are the things we should follow.
Right. So we have a new mantra now, SMS. No, it is not short messaging services. It is sanitizer, mask, and social distancing. Thank you for giving this mantra. Now we have talked about everything. We have seen the signs. We have seen the how dangerous this virus is. We have seen the treatment for that as well. We have talked about the measurement as well. Now, compared to other disease or other viruses, how would you scale this virus?
I would say again, it's a Bechara virus.
Okay.
Don't be afraid of
I
it.
really like this name, Bechara virus. It gives us a feeling of powerful,
Yeah,
It
exactly.
already gives you the
Exactly.
immunity booster.
So I always tell my patient that keep on thinking, do self-suggestion
Right.
that this is a Bechara virus. This cannot do anything to me.
Hmm.
Basically, if we talk in scientific data, mortality and morbidity. Mortality का मतलब करेंगे कितने लोगों की मृत्यु होती है और morbidity का मतलब करेंगे कितने लोगों को symptom आता है. So mortality, we are not afraid of COVID-19. We are afraid of mortality from COVID-19.
Right.
So if we talk in terms of mortality, currently there is mortality rate is 1.86%.
Okay.
So if 100 patient gets infected with COVID-19, out of that only 1.86 dies. That too having age more than 60, any comorbid disease like liver, kidney, heart, any autoimmune disease, lung disease like asthma. So their mortality is little bit higher. I won't say it is extreme, but it is little bit higher. So if we talk pulmonary tuberculosis, we don't even bother about TB. TB has much more mortality than COVID-19. Road traffic accident, it has much more mortality rate than COVID-19. Are we afraid of driving car because mortality rate is too high?
No.
So I would say don't be afraid of. Yeah, stay cautious, but one must be aware, cautious, and still brave enough to live normal life.
Right.
Brave enough to live in new normal.
Right.
So that is the only thing we can do with this virus.
Exactly.
So this virus, yeah, after understanding this virus, we would say that morbidity is very high. Morbidity is how many people gets infected, how many gets ill. So those who get ill, out of that, more than 75% don't require hospitalization. Only 25% needs hospitalization, and that too ICU care is required in less than 10%. So again, this virus is not as dangerous as we have taken it previously.
Yeah. Thank you, Dr. Kunjan Joshi. So we have two things to follow, guys, in the COVID-19. That first, it is a Bechara virus, and there is no need to worry about it. Second thing, always follow SMS, sanitizer, mask, and social distancing. Thank you so much for joining with us today, and we
Thank
would
you.
have more and more sessions like this
Thank
with
you.
you, sir.
Thank you.
Thank you. Thank you for watching this video. We have had Dr. Kunjan Joshi with us, who guided us throughout the COVID journey. We have came to know about everything, that how you should prevent yourself from COVID, what things you need to take care of, and how dangerous the virus is. If you want to have more and more updates like this, stay tuned to Vitamin C. Please do not forget to press the bell icon and comment, like, share, and subscribe. Thank you so much.